Hi everyone, and welcome to another virtual event with us at the Dialogue Society. I'm Iysha, a research fellow at the Dialogue Society, and I'll be chairing our online discussions this evening, and also try and provide a brief and quick outline of some of the community work we've been engaging with during this challenging and unusual pandemic. So I'm excited today to be discussing the topic of lessons from the coronavirus pandemic, a community perspective, which I think we'd all agree, that our speakers and viewers is a very critical and timely topic, as we're slowly starting to come out of this lockdown process we've been in for now over 2 months, with the government guidelines being slightly more free now. So our perceptions and perspectives have undoubtedly changed. From evaluating our own working conditions, in our personal lives, to our community relations at large, of which we have been seeing a lot of critical questions being asked, rightly, from how to protect the most vulnerable in society, women and children from domestic abuses during this period, to larger grand scale questions about systematic issues such as racial equality. We have seen communities, however, come together during this period, with thousands applying to volunteer with the NHS just hours after it launched its online campaign, to people checking in with their elderly neighbours, our clap for heroes, our rainbows of hope. But is there something we're missing? I hope today's discussions can shine some light onto this debate as we're coming out of this pandemic step by step. We are going to see a shaken economy. How will this, for instance, shape our community relations? Do we have lessons still yet to learn? Just before I do pass on my screen to say to our speakers, I'd like to thank specifically our volunteers at the Dialogue Society, who under our perhaps day-to-day normal conditions are the backbone of the work we do. With the cookery clubs they run, the book clubs they facilitate, community breakfasts, interfaith discussion forums, and many more things that they would do on ground to keep the spirit of dialogue alive. Under the conditions of this pandemic, they've been working hard and busy still. We clearly saw this when the pandemic first started, and everyone within the community tried to be of help to one another within their own local communities. From working in partnerships with local charities, delivering food aid and listening, as many found themselves vulnerable and lonely in communities. Our volunteers help organise the UK Praise Session, multiple sessions even, of interfaith platform with religious leaders from major religions in the UK, and also non-believers too, coming together displaying the unity amongst faith and non-faith groups, giving a clear message that divide was not welcome in our society and that we will stand stronger together. They later went on to participate in a series of community online iftars, something that we'd usually do and have been doing for the past 20 years throughout the UK, bringing diverse communities of religious and professional and community leadership roles together to discuss a common theme. We this year, unfortunately, didn't have the food, but tried to bring our community leaders together to discuss the topic of how we can stand stronger together, how our community relations are critical for us still. We brought together our brightest stay-at-home moments from both an English and multilingual video format to share hope into some of the perhaps most difficult days that we've faced, to show the new hobbies that people have been picking up or how people are trying to get by their day-to-day lives. Many of our volunteers have helped by donating beautifully baked goods to our NHS workers as a signature and a shape of recognition and thanks for the work that they do. We continued with our dialogue book club online. Just recently, I attended a meeting with our volunteers and heard some very inspiring ideas that they have to keep our community connected, as although some of the restrictions have been relaxed, it seems that we're going to be in some sort of social distancing measures still. And I'm sure their continued efforts will be shown and brought together the community over the upcoming days, weeks, and even furthermore. So I'd like to thank both volunteers with the Dialogue Society and all community workers across all organisations for keeping an uplifted spirit throughout. To continue with today's event, we're very fortunate to be joined by a prestigious line of speakers. And without talking too much, and I'd like to just highlight a few housekeeping or perhaps Zoom keeping points we could say in the background, as we're aiming to be done by 6 p.m. Each of our speakers does have a 10-minute slot in which they'll share their views and reflections on the topic. And we're inviting some comments to be shared during this too. And then we'd like to save our larger questions to the end and would welcome questions through the live chat section on the YouTube video, so our viewers can also propose questions to our speakers too. Our speaker, Janette Arnold, does have to leave slightly early, just before the Q&A. So we're inviting our other speakers to propose their questions to her just after her speech. And hopefully we can wrap it up and get along with the rest of the program afterwards, as I'm sure, you know, many valuable points are to come up in her speech. So without further ado and holding the mic for any longer, I'd like to extend the floor to Janette Arnold, who has been a London Assembly member for 20 years now, and her work focuses on key strategic issues of the lives in her constituents in Hackney, Islington and Waltham Forest, mainly focusing on improving the transport services, reducing crime and providing affordable housing opportunities. She's a champion in the fight against forms of injustice and discrimination. So Janette, please, the floor is yours.
Thank you, Iysha, and good evening. Is it evening? I never know. It's late afternoon, isn't it, this time of day? And just to add to that, it's been my pleasure to have worked with Dialogue Society over the last 15 years. And of course, one of your first locations was within my constituency in Islington. And I really have appreciated what you've done as an organization in terms of bringing together people, spreading goodwill across faiths and across communities. And that it sometimes feels to me that I live and I work with people that we have been, if you like, on this journey for so long, so that we have been building relationships. We have been always concerned about the fabric of our community. And that's because it's an area that's very dynamic. So we have had our share of tragedy. And of course, we have a population of people who arrive in North London from other places, seeking a haven and are looking for the best of themselves and their families. And we are now together facing, I think, one of the greatest challenges we've had to face as a community, certainly in my lifetime. I'm familiar, but still amazed, because my professional background is public health. And so I have been involved in, outbreaks of one sort or another. But I would agree with those who say we have had absolutely no experience of anything like this in the UK and in, if you like, the Western democracies. I know that Other areas have had SARS, and we've had outbreaks of other pandemics before in other parts of the country. But this is something that is totally new to us. And the pain and the suffering is just unfathomable. I don't know that anybody can put any sort of judgment to it. And I would just like to say, if there's anybody who is listening to this and that you have lost a loved one and or maybe suffering yourself, you know, please accept my condolences, and you are in my prayers. So you asked me to come and sort of just, I suppose, to share with you my thoughts on what's happening locally. So, I mean, I have to say really that looking for the stars in this pandemic night sky is very hard. It's shrouded. But it is right that we have discussions like this, and that we do identify those areas of learning, those bright spots, because it's that can help us to, if you like, heal, help us to stay together so that we can get beyond the coronavirus pandemic. Personally, I have been hugely impressed by the determination of people within my constituency of North East London, and that's been reflected across London and across the country, and indeed across countries other than ours. And it seems to me there's just been this rising up of a feeling that we are one, that we have to get through this together, so that we have to be looking out for each other. And it just seems to me the people who don't do that, if you like, stand out like a sore thumb. So many of the people who we expect better from have disappointed us. And, you know, but I think what's good is sometimes you need, I suppose, to acknowledge where these variants are so that you can see the good of the majority. I would just like to congratulate Islington Council, the council that I live in. It's one of the 3 I represent at City Hall. And they have worked so hard to ensure that anyone who's either self-isolating, in need of food, in need of childcare, that there's support on the end of a number, or that people indeed have come and knocked the door. And we heard of the Dialogue Society's own activities. And so there has been support in communities, by communities, and if you like, this mutual aid across North London. And I just can't pay tribute enough to those who have risen to the challenge, and the food banks, shopping for others, as I say, reaching out to friends and neighbours and making sure that our community can get through this. It just, you know, I'm in that category of being shielded. That's because of age and a chronic respiratory condition. And I have to say that sometimes when I don't hear any explanation about what's going to happen to my group, I panic. But I'm assured that I've got shelter, I've got food. So I'm always then reminded that there are so many people who are vulnerable, people who can't access any benefits, people who are homeless, the children who are locked in situations that we would normally be taking them out of because we know those situations are harmful to them. The circumstance is just, some days it's just too much to bear. But then you're reminded, as I said, and you're asked to gather in a communal way. I thought the clap for carers brought about not only that community cohesion, but a new respect for those who do this personal care, because, you know, they are the least paid. And unless you have had personal care in your own circumstance and your family, you perhaps don't know about this huge force that are out there that are so essential for the daily well-being of so many. So I do think it's brought about that respect and understanding about the essential work of some of our essential workers who we sometimes maybe don't think about. You know, when we, I think in the future, start to look for heroes and heroines, I'm not suggesting we build monuments because we have enough problems with the monuments we've got, as we can see. But, you know, my heroine and my heroes will forever be, you know, those who are getting out of the bed earlier than the rest of us to get that bus on the road, knowing that they're placing themselves at some significant risk. Those who are getting the transport out so essential workers can go to work. And you know, there are those wonderful the group of staff who have just been constant, and they've not let up, they've kept on doing their work. And so I just think sometimes, you know, let's hear it for refuge collectors, let's hear it for postmen and the corner shopkeeper. These people doing these essential works are going to be my heroes and heroines. And then, of course, if it wasn't enough with coronavirus and all of the inequalities in terms of who is getting it, because the people I've just mentioned, especially if they come from a Bengali or from some of the Black and other Black and minority ethnic groups, they have been the ones at the front line. Whilst doing their work, they have been the ones that we've seen who have given up their, made the sacrifice in terms of their lives. So we can't forget this. And so going through and the other side of COVID, we've got to be asking our questions about how we value staff who are there, who are essential to making our lives the way they are. And we've got to be fairer as a society and give equal and better treatment to everyone. I'll just finish by mentioning George Floyd's killing. Let's not forget, George Floyd's killing is not in isolation. I saw a chart this morning that had images of about 30 women who had been shot by police in one or other states. One of them that struck me and really took my breath away was a neighbor had called the police because that neighbor was concerned and was seeking a well, you know, like a neighborly act by that police officer to say, can you check to see if this person is well? And for whatever reason, the police officer who arrived at that lady's house came and took an approach which they have in America, a no-knock approach, kicked down the door. Of course, the lady was surprised, she moved and she was shot dead. So we have to understand that George Floyd's murder is in the context of a society, it seems to me, that is brutalized, a society, and we've got similar issues here in terms of how we treat each other, how we deal with our own prejudices, how we deal with our unconscious bias for ourselves and within our institutions. And we do have a lot of work to do. So I think for me, that's the great lesson that's come out of COVID so far, COVID-19 so far, is we are not as safe, we are not as secure as we believe ourselves to be. We are not as equal, we are not as fair as we sometimes believe ourselves to be. We are absolutely ignorant in this country in terms of our imperial and colonialistic past. And we have to find a way of valuing everybody and we have to take the best out of this COVID pandemic to the other side and really commit ourselves to working to create sustainable, healthy, fair communities. And that's really all I've got to say at this moment.
Thank you very much, Janette, for both your kind words and reminding us that the topic of discussion that we've got here today is one that's been on our table prior to the pandemic too. And you highlighted a series of positive examples, and that the majority of us are doing our part to bring the community together and stay safe at the same time. And that those who don't, stick out like a sore thumb. But nevertheless, at the same time, you also mentioned, the variety of inequalities in society, which can make some groups more vulnerable. And within those groups and groups at large, there are risk groups, those in risk categories like children, who may be prone to domestic abuse, for example.
Yeah.
I mean, what do you think we could do as a community at large to help? Is there anything we can do? Should we be engaging with other organisations, or what could we do as Londoners, perhaps?
I think small units work when we're reaching out to give support. And I think the best unit to work through is the local council. And so I would say to everyone, if they've got time, if they wish to volunteer, if they have any information, if they're concerned, if they're hearing more crime than they would normally hear, anything. This isn't about you telling tales. This is just about you raising your concern. And I do have confidence that if you can then put that forward either directly through to the council officer, or also what you could find is we've all got a councillor, because of our address, unless you don't have an address, and in that case, just find a refuge or indeed the town hall. So we can all find somebody to reach out to say, these are our concerns, but also as well, what have I got to contribute? What do I bring to the table? I think this is a time where we have to bring maybe one of the most valuable things we have, and that's our time. We sometimes forget that.
Thank you very much. Do any of the other speakers have any comments or questions they'd like to propose? Yep, Simon. Your mic muted.
Okay, you are unmuted. But okay, right. one broad question. But it may have lots of tributaries. I agree with Janette that there are lots of critical things that we need to learn. Sometimes I think there's evidence that we're beginning to learn, but I'm not sure if that will be sustained. So my question is, how do we as a community begin to develop pathways that will sustain these kinds of attitudes? Have we got any evident pathways that we can really nurture and really open up? Any architecture that will, forgive the mixture of metaphors, that will enable us to sustain those kinds of attitudes and practices that you're talking about?
Yeah, sometimes I think we're always trying to reinvent the wheel, and so as a person of faith, I welcome the fact that churches have been reopened, or if I think it's for private prayer from this weekend. But I really do think that I would say to people, find out more about what's happening in your faith community, because these communities are there, they're sustainable, they know the locality, and we tend only to hear negative things about faith communities now, you know, one or other aspect of that. So I would ask us to just step back and say that there's so many faith communities on any street, you know, and I don't know that you have to stay within your religious sort of, you know, band, you know, step out and find out what else is doing, because, you know, there is so much going on. I could spend all day doing this. You know, you can do virtual visits now. You know,
that's nice.
So you ring somebody, they take their phone and you go walking around different centres and places that people are volunteering, and you name it. It's faith communities, it's local communities that are really out there on the front line. So I say we've got to appreciate that and join them, and not because of the faith, but because it's a community and they've got the structure already there.
I have a question for Jennette.
Go ahead, please.
Okay. Jennette, thank you very much for your interesting words. You mentioned the work of Islington Council, and obviously the work of the councils is really important. You're also mentioning the important work of faith groups, a lot of it voluntary. Obviously, we've had 10 years or more of austerity. The pandemic has hit the economy hard. The issues that you're pointing to around fairness are arguably going to need resourcing to some extent or another. How do you see that particular problem in terms of, particularly from a kind of local government point of view? Are local governments going to have the resources to tackle these kind of serious, particularly these systemic issues? How do you see that?
Thanks, Phil, and thanks for raising this. And I just want everybody to be really aware of the conversations that will be taking place over the next couple of months, because you have put your finger on the spot, Phil. Our local councils are now, if they're not in their reserves, they're really quite low down in terms of funds. And I have to call out national government here. They have been slow particular times during this crisis. They cannot afford to delay in making substantial, significant, and I say significant, they have to be able to put the money into local authority where it's at the front line. This is where the interaction with the citizen takes place. Do you see what I mean? So, and I really want to see less of this contracting out on a national basis to more using our local councils, because they know what's going on in their locality, giving them the funds so that they can then start be able to deal with the most vulnerable, to be able to give the support to families so that they can be looking to see how they can reshuffle or get to grips with getting back to work in some way. And they have the problem, you know, there's the whole issue about that our children have got to go back to school sometime or the other. Local councils have got to do that. Our local businesses, they have a relationship with councils in terms of a lot of them have had their rents deferred or their rates deferred. So a lot is going on, but I just really have to make a call out to our central government, you know, really work with local government. That's what government should be doing, working together so that we can see some sort of service to the people.
Thank you very much, Jennette, for, I mean, we did have a question come through on the relationship of government and how it's significant, but I think you've answered it beautifully there.
Thank you
very much. Thank you. And now I'd like to go into our next speaker, Phil Chapman, the director of the Faith and Belief Forum. who joined specifically to apply his peace building experience to a more UK context, and sees a potential in combining peace building and intercultural approaches and strengthening relations on a community level. So Phil, floor is yours. Thank you.
Thank you very much, Iysha. And I want to kind of echo what Jennette was saying about our thoughts for those who've been badly affected by the coronavirus pandemic, which, as we know, a lot of people, a lot of families, and thoughts are with those people and those of you who've been affected. What I want to say is going to cover similar ground to what Janette has covered, but I want to hang it on maybe three lessons, three kind of issues that encapsulate the lessons that I want to talk about. And they're the three I's. Interdependence is the first, the second, inequity, and the third, inclusion. And I say this from the point of view of an organization that I work for, which is an interfaith organization. So we at the Faith and Belief Forum work to strengthen productive relations between people of different faiths and beliefs. That's religious and non-religious. So we're very much about dialogue and about people coming together from different faith and belief backgrounds to tackle common goals. And perhaps the coronavirus has presented a common challenge to everyone. And that leads me to the first area I want to talk about, the first lesson, which is interdependence. And I think, as Jennette says, a lot of mutual aid has been demonstrated. Mutual aid practices have been demonstrated during this pandemic, which have given us a lot of hope about our communities and the interdependent nature of our neighborhoods and communities. Of course, the coronavirus also shows that globally we are interdependent, and what happens in another country is going to affect those living in other countries. But in terms of neighbors, I think neighborliness, in terms of communities, there's been a lot of examples of mutual aid coming together. For example, not only between faith groups, but between faith groups and other types of organizations. For example, in Bradford, an alliance between faith groups and Age UK to try and address the issue of those affected who are more elderly and isolated. Also mutual aid, but intra-community mutual aid as well. There was a mosque in the Midlands, I know, who had to kind of give its car park up to act as a mortuary, and really kind of adapting the way that community works. There's been lots of people kind of coming together to deliver food parcels, and the stories go on. I think in terms of some of the work we've been doing in Barking and Dagenham, I think one of the things that we've been struck by is the kind of interdependence and alliance that has been shown between local councils and communities. We began to touch on this earlier, but there's a citizens alliance that has been formed between the council and local groups. And it's interesting that a lot of those groups actually are faith-based. And if we think of London, sort of white, the total population of London, there are about 24,000 voluntary groups. A lot of those are faith-based. So I think faith-based kind of groups play a really important role, and they have done in the coronavirus pandemic to working not only with other groups, but also with local government to try and address immediate need. Of course, that doesn't mean that interdependence has been kind of equal, if you like. And that brings me on to the second point, which is really about inequity. Of course, some of us are more dependent on others than some others. There are different levels of dependency and interdependency. And of course, some communities are neglected. And I think some of what we've learned through the pandemic has really been how the inequities in our society have been kind of laid bare somewhat. I mean, some of the ways in which we've seen this is the way in which sort of Black, Asian and minority ethnic communities have been much more affected by the coronavirus. Some studies are saying that it's sort of, you're twice as likely to die of the virus if you're from these communities. Other studies have said that they've looked at patient groups, and you know, amongst the survey, 35% of the groups they've been looking at are from BAME communities, and that's in comparison to 13% in the UK, UK wide. So there's obviously, and I think this is well known, this is kind of an issue. And I think what that issue shows is some of the kind of socioeconomic kind of issues that we've been trying to address for years, but somehow they've been highlighted through the pandemic. And as Jennette says, has reminded us that we've got a lot to do to address some of these inequities. I say sort of been talking about the BAME communities, but of course other communities have also, there's other ways of looking at that inequity, and one way in which we forget, perhaps particularly because we are on Zoom and the whole world seems to revolve around the Zoom technology and the internet, is that not everyone has access to the internet. And those who don't have access to the internet are perhaps falling even further behind in terms of their ability to get support, to remain connected and so on. And that's something that I think sometimes gets lost. The other area which is quite interesting, I think, is the whole age demographic and how this pandemic has raised issues around the elderly, the way in which they've been treated, the kind of attitude to care homes and so on. So I think there was a lot of issues around that we've learned through this pandemic, which has been about inequity. And I have to say that I just want to mention that perhaps at this point as well, the George Floyd killing at the hands of US police has also kind of deepened and widened this this conversation and indeed protest about inequities in our society that we really need to tackle. And I know that my organisation needs to step up the way in which it engages with these more systemic, if you like, issues in our society. So we're about dialogue, yes, but we need to focus that dialogue on tackling the issues that are important. So interdependence and equity. And the third issue I just want to touch on really is the third I, is inclusion. And this issue, I think, is much more, when I think of inclusion, I'm thinking much more about the looking ahead. It's about, well, what do we do? Okay, we've learned that we're dependent on each other, that we can help each other. We know that there are a lot of inequalities, inequities in our society that we need to tackle. So what's the way forward? And I think for me, it's about inclusion. And I think our challenge is to try and generate a more inclusive partnerships, whether that's between faith groups and communities themselves or between local government and communities, both those types of partnerships. I think we've got to find ways of doing it in more inclusive ways. I think the opening of faith places of worship is a case in point. I think there's been a lot done to try and talk about how we open those. But I do also know from the feedback from communities that not all faith groups have felt included in that discussion. I think some of the smaller places of worship face kind of challenges that are different to the bigger ones. And it's difficult to get a sort of more inclusive approach to that issue. And I think that's just an example of one area where we need to make sure that we bring in minority voices, that we bring in those voices that have been traditionally more excluded from society. So I think the opportunity now and the need is looking ahead is really to work on inclusion and getting people involved so that they have a stake in what we're building out of this pandemic. And perhaps the most important this is my final point, but I'll leave it, which I think is something about looking ahead, that there may well be a second wave. And I think we do have to, one of the reasons for being inclusive and for kind of coming together, banding together in this, is that so we can minimize the fingers that are pointed at people to say, well, you know, this is why there was a second wave. We want to avoid, you know, this sense that our future is being determined by someone else. So we've got to find inclusive ways of rebuilding and going forward from here. So I'll leave it there, but thank you very much for the opportunity to speak.
No, thank you, Phil, for highlighting, you know, with your Janette's off. Thank you very much. Thank you for your participation. Yeah, so thanks, Phil, for highlighting with your 3 eyes, you know, the role of interdependence and how we need to work as a community to defeat, hopefully, the inequity within society, and perhaps, you know, inclusion is the role for that. So I think it was nice how you know, provide such an argument with your 3 eyes. So thank you very much. Just a bit cautious of time, so I'm going to go on to our next speaker and then hopefully have the questions at the end now. So last but not least, we're on to Reverend Professor Simon Robinson, who has experience in both the psychiatric social work and also as a Reverend in the Church of England since 1978. He's also served as a university chaplain and has current research interest in religious ethics and care, interfaith pastoral care, professional ethics, ethics in higher education, and many more areas which are just too many to cite now, Professor.
Come on. Okay, I'll crack on. I want to start with the ending point of Phil, because I think the part of the problem about the pandemic is that we are now experiencing that life is being determined. The pandemic has determined that we will change our life in some way. You know, I mean, if we don't change, there may be consequences. And that's an interesting question, because there are a whole number of things that I don't think we are good at in the Western world at dealing with. We're not good at dealing with not having control of a situation and how to manage uncertainty. I've worked a lot with business people, and very often the business gurus are really talking about there's always a solution and there's always a way of managing and we'll sort it out. Leadership is all about that. Not the case. Good leadership is about how to manage uncertainty, because every part of our life is uncertain. There's a wonderful thing that the American Army produced about the uncertain environment. They call it VUCA, which is the environment is variable, uncertain. I can't remember what B was, but A is ambiguous, and this is what the environment is. There's nothing clear, nothing certain, nothing solved. So I think that's the first thing, and therefore I think this is beginning to teach us that we have, and I think both Jennette and Phil were talking about this, that we have to understand how to live with risk. Risk, you know, that's a part of who we are, and I think that's part of it's a critical part of spirituality. A lot of us think that security is, and it is, that sense of feeling secure with God is important for spirituality. But actually, until we understand our risky environment, it's very often difficult to see God. You know, life is full of all difficult things. So, in that sense, we're determined, and there are lots of things that we have to sort through and think through. It's big challenges for where we are. I think, and I want to agree wholeheartedly with Phil's three eyes. And I think we've seen, as Janette is saying, we've seen some real senses in which we've been trying to work those through and live those out. You know, people are lining up to volunteer, to help, to live that kind of mutual responsibility that Phil talked about, which is fantastic. I think part of my problem is that I'm getting old, and I'm getting more grumpy as I get old, and I keep thinking I've seen it all before, and certainly history has seen all this before. Yeah, you know, go back to fiction, go back to fact, go back to Camus' The Plague, and right at the heart of that, he's got all these incredible values about empathy and so forth and so on. But part of the message of that is, whatever it is, you know, be it a pandemic or be it a fascist dictator, these things come around again and again and again, and we don't learn. Now that's why I wanted to know about pathways. What are the pathways that we can actually begin to find that will sustain this enthusiasm, that will sustain the insights, that will sustain the values that we have newly? Isn't it amazing? You know, the values that we've suddenly begun to appreciate. 6 months ago, I don't think we were valuing the National Health Service. Yeah, the National Health Service is amazing. But actually, there were lots of toing and froing and fighting and conflict going on about what it's all about and what healthcare provision is about, and it should be this and it should be that. And we had the mid-staffs hospital tragedy where up to 1,000 people died unnecessarily because the care was messed up, because we were focusing on this is all too brief a conclusion, but we were focusing on other things like getting foundation status. We didn't see what was before our very eyes. Well, now it's difficult not to see it. You know, we're forced to see this important message that Phil's talking about of interdependence. Wow, you know. But I suppose for me the big question is, what is our learning mechanism? Is there a mechanism in place, or are we just going to say, yeah, let's do better, let's join this, join that, whatever. What I would want to focus on then is both the failures and the successes in our response to the pandemic, and suggest that there might be important pathways that we can really have a look at and re-estimate in terms of where we are. Now, I think the key to that is dialogue, full stop. And I want to argue that the majority of organizations do not practice dialogue. Churches don't practice dialogue on the whole. Forgive me if your church practices dialogue, but on the whole we don't. Business on the whole doesn't practice dialogue. There was some research in 2015 where a researcher in Australia asked leaders what was their style of leadership, business, and they all said it's dialogic. We're good dialogue characters, you know. They said, the academics said, can we just check that? Of course you can. And they discovered that 80% of communication from this top and very able leadership was one way. And what that said was they don't listen. They do not listen. So question mark, why don't we listen ordinarily? And his conclusions, the researchers' conclusions were, A, we focus too much on this the solution-driven approach to leadership. The leader will know all the solutions, and we'll find a way, and all the risks will be sorted. No problem at all. Yeah. But secondly, actually, the leaders didn't understand what listening was. They didn't understand the nature of listening. So this particular researcher, a guy called McNamara in 2015, he goes through the nature of listening. And I think most of us would look at that and probably say, yeah, I'm not sure whether I practiced that last week. So I think we need to go back to the drawing board and find out what it is to listen in our particular area, if we are listening and if we're in this kind of dialogue situation, and how we can develop what McNamara talks about, which is architectures of listening in our organizations. That means having ritual in the organization, and I use that in the broadest sense, which constantly values listening, constantly talks about it. That means having leaders demonstrating what it is to listen. And that's difficult because you can't demonstrate listening unless you do it in an unrehearsed way. And most leaders want to communicate through rehearsed approaches. So I think we need to come back to that and look at how we can do that in our own organization. So as Phil says, intra, but also inter. How do we communicate between the different organizations? There are real hints there of pathways that have been emerging. Wow, I mean, wow. Which is why I get so annoyed when we get to the schools issues. Oh, well, we can't do that because we have the limitation, which is space. But dialogue, one of the things that dialogue does is to excite the imagination. It helps us to look at pathways and ways forward. And if you look at some of the places across the world and in our own country, in Copenhagen, officials there in terms of schooling have brokered more than 100 agreements with various businesses, cultural institutes, including cinemas and football clubs and housing associations, to create space for around 3,300 children from schools and daycare facilities. Whoa, that's the kind of imagination that we had for the National Health Service. Let's have our Nightingale things. How can we do it? So, number one, we need to build an architecture of listening. For me, this is a big learning point from the pandemic. Number two, we need to exercise our imagination, our moral imagination, our practical imagination, to see how we can put those principles that Phil eloquently talked about into practice. Because if we don't do that, I don't think. For me, that's how those principles stay alive. If we see them instantiated, if we see them, what it looks like. What does it look like to live out these principles? And for many organisations, it's a very, very difficult challenge. I'm a member of the Church of England. And the Church of England, like all churches, like all religions, can easily become focused too much on our own defence and on our own rights, religious rights, and all that sort of thing. That happened in the States. The pandemic was all about the religious rights. They need to open the church because of the poor old religious people. But actually, we've got so much space in religions throughout our country. What about making sure that is part of the imaginative response, working together, not worrying about whether we're giving a pat on the back for it, but actually worried about how we can help to instantiate all of these core principles. We've got a great Sikh temple in it's either Leeds or Bradford, which is doing some fantastic work. They're pumping out so many meals. It's amazing. It's amazing, and they're doing it in such a low key way that it is wow, astonishing. Now, so final point. But two quick final points. I think the dialogue that we're talking about, and what we need to do in terms of that dialogue and listening, we need to be aware that it's multi narrative. We have to listen to all the different narratives, which is part of the inclusivity that Phil talked about. But it's also part of the difference. And therefore brings up all kinds of challenges. So, for instance, with the justice agenda that you both talked about, absolutely right. But we need to think big and broad about that. The whole protest movement, fantastic, absolutely right. But then we need to think about how that protest movement might actually make things more unjust. Because if we're all out there protesting and there's more and more pandemic, then there's more and more people going to be affected by that. And it's precisely those groups who have been oppressed who will be affected by that even more. And we can't go forward unless we have dialogue which listens to all of those interconnected narratives. So I think there's a key thing there about dialogue which is big and broad and interconnected. But there's also something about going back to things that we've already done in Leeds, and also everyone taking responsibility for this. In Leeds, we've done some really good work on obesity, childhood obesity. I'll be one more minute. But the biggest example of this is in Amsterdam. They have an incredible response to childhood obesity. It's been cut by 13%. And it's been cut because they found pathways, dialogue, action together, everybody working together, business, schools, families, and everybody in that situation taking responsibility, both for themselves and for each other and for their community. So my plea is we need to look at ways in which we can really show what these lessons look like, how we can instantiate them and demonstrate them to each other. Because if we can't show that, I don't think we're going to be able to maintain those lessons. Okay.
Thank you very much, Simon, for highlighting, the interconnected role of leadership and moving with risk. Talking about, the mutual responsibility we all have, and also, having an emphasis on looking for the multi-narrative and providing spaces for dialogue, whether that's, in religious communities or on local communities as a whole. Saying that, I have a very interesting question just coming up on our live chat on YouTube by one of our viewers. How do we, both religious and humanists, non-religious people like me, sustain in the long term the gains in community awareness, cohesion, and awareness of inequity achieved during the lockdown? So we've talked about lessons that perhaps we have learned and an experience we've gained, but how do we sustain this as religious and non-religious people amongst, the diverse community?
Is that to me or not to Phil? All I can say is that we go back to the basics. We go back to the dialogue now, and look to the places where dialogue might occur within our community. Let me give you an example of where we, in my local area, failed miserably. As a university, we said, we're going to try and create a dialogue. So we talked to the churches and they said, great, we'll get involved. And then we talked to the local council. And then the local council talked to a few others. And actually, we didn't get very far, partially because everybody wanted to be seen as the ones who were creating dialogue. Yeah. And one of the dangers of the church focus or the religious focus is that it's about location rather than engagement. Location is saying, look at me, I'm religious and I'm doing this and that and the other. Okay. The message from me is that we've got to focus on dialogue, which is about engagement. Phil was right about this. How does the dialogue result in practice? What are the outcomes? What difference will this make? Now, that says we've got to identify the places, the times, the spaces where we can have a public dialogue, where we can generate public dialogues, lots of different dialogues. Public space, having the public square where people can begin to do what they used to do in Greece. It was just in ancient Greece. It was just norm that you go down to the public square, and you will have people who are talking and listening. That seems to me to be the crucial thing. But to do that, we need to have a conversation about how we do it, about how that's achieved. And that is very much down to all of those big players coming together and saying we can do it as a team. Sorry, Phil. Go on, you.
No.
If I could just add to that question, I think it's not really an answer to the question because I don't have a clear answer, because I think, as Simon says, the pandemic is changing us, and one of the things it's changing that I can see from through the lens of our organisation is how we make contact with each other.
Yeah.
One of the things that underpins, non-religious and religious kind of working together is people of different faiths and beliefs understanding each other better.
Yeah.
And that understanding comes from contact. And here we are sitting in our homes.
Yes.
And as I said before, not everybody has access to the internet. The forms of contact and engagement have changed radically these last few months. I suspect it'll be, the way we engage and interact may be different for some months to come. So I think there are some challenges around that in answer to that question.
I think you're right, and part of the challenge is sort of with trust, because we tend to generate trust better when it's face to face. So we can look at the other person, look them in the eye, so that we can confirm from how they look, their physical response, that they've got our interest at heart, so we can trust them. Yeah, it isn't always the case, but it's better if it's face to face, and it's certainly better if it's unrehearsed. You can ask questions, what people call trust diagnosis, and check out where they are. It's difficult. It's difficult over the internet. But I tell you, an old friend of mine, when he retired for the fourth time, went to become a tutor for the Highlands and Islands University. And they only communicated in those days by email. And at the end of his sessions there, he got an email from one student who said, "This has been the best experience I've ever had of teaching. And I trust you more than I've ever trusted other teachers." So I think that's a huge challenge. How your very point, Phil, about communication. How do you develop that kind of communication virtually? How do you enable that? Now, my old mate suggested that it was about you have to work harder at communication, at clarification, at listening. all of these things.
You're gonna have to learn new tricks.
Sorry?
We're going to have to learn new tricks. Yeah.
Absolutely. Yeah, new techniques, whatever. Yeah, exactly. And maybe that is important. But it keeps going back to the point, doesn't it? That you know, if you look at the example in Amsterdam, they have a great example of inter-organizational learning. They worked this together. Now they showed how you can learn. So back to my point, you know, how are we going to plot our learning from this experience? Because as everyone keeps saying, we're not going to go back to normal. Not normal.
Thank you both for your valuable contributions. We've just got one last question, and I'm cautious of the time, so I think we can wrap it up after this question. I mean, we all mentioned, you know, the tragedy of George Floyd and you know, the legacy of something which has been going on for centuries, really. Talked about the racial tensions. We've got a question about religious tensions. And the question is, what advice would you give to lessen religious tensions in societies and achieve a sustainable peace amongst our communities? You know, is this something that you've seen with your own organizations or own work increased in this time? I mean, I remember at the very beginning of the pandemic seeing, you know, anti-Semitic and Islamophobic discourse around the spread of the virus. You know, is this something you've noticed, and how could we lessen this religious tension, perhaps?
Yes, I mean, it's a good question and a difficult question. I suppose from our point of view, part of that lessening tension between people of different faiths or different groups is partly back to trying to create opportunities for connection so that there is greater levels of understanding. That's difficult at the moment, I know, but that's a kind of one principle. The other way is kind of more getting at the other kind of line of thinking in this kind of exchange, which is more about trying to tackle the kind of the root causes of that tension, which would need some analysis. You know, that not all tension between groups is caused by the same issues. So there's a need to understand what's driving that tension and to try and tackle those causes. That might lead us to trying to address some of the kind of more systemic issues that, and some people will refer to structural kind of issues in society that give rise to that tension. So I think two answers to that question. One is to create spaces for engagement, encounter, and understanding, and that dialogue, that theme of dialogue that we've been talking about. But the other is to try and understand what's driving the tension, and often maybe linked to some more kind of systemic structural issues that require a different type of action to try and address those.
Yeah, I would agree, and I think it's a very interesting thing that we should talk about tensions between religion or religions. The old Jonathan Sacks wrote a book a little while ago, Not in God's Name. It's an interesting book, and that seems to suggest that actually tensions between religions are a little bit like tensions in families. You're always going to have them. I used to be involved in an interfaith chaplaincy team, and there were so many tensions. I mean, it was endemic for all kinds of reasons. You know, the Anglicans wanted to make sure that they were in charge. The Methodists wanted to make sure that the Anglicans were in charge. And it was all like, you know, the kind of dynamics that you get in families with brothers and sisters, and seeking attention and all kinds of things. And for me, I agree with Phil. It keeps coming back down to practicing listening, practicing being together, practicing how we can make a difference. It's kind of straightforward. It's kind of straightforward, and yet at the same time, it's difficult. It's hard. It's hard. Dialogue. Yeah, come on.
I think one of the issues. Sorry to
go on. Yeah.
Jump in. Some of the challenges around that dialogue and that listening are often it's challenging to your own to yourself. So if you open that dialogue, it can be personally challenging because you have to also ask yourself about what assumptions you hold. You have to ask yourself about your own way of looking at the world and to kind of reflect on that. And that, particularly when we've been talking about the issue of kind of institutional racism and so on, that can be a difficult process, a challenging process. I think one of the challenges involved in that listening and dialogue, as Simon's saying, is that it's often not easy. You have to go on a journey, and that journey is sometimes not a comfortable one.
Absolutely right. Absolutely right.
So yeah.
And what I would advocate, A, to support what Phil said, and B, to advocate a way forward, I would advocate that the churches the religious bodies move into dialogue sermons. Dialogue as part of their ordinary experience, either your Sunday experience or whatever. I think it makes all the difference. It makes all the difference. And just to share a personal experience, Phil, a long time ago when I was in the Episcopal Church in Edinburgh, we instituted dialogue sermons. Now they worked, and they led to changes of policy, which were much better than having a parochial church council. Much better. But the first day that it happened, I said, now don't forget, from today, you can shout out, and you can enter into some kind of conversation in this sermon. And 30 seconds into my sermon, an American student, PhD, feminist, at the back of the church shouted out, "You're wrong." I informed me that Jesus did not go to church; he went to the synagogue. Quite right. Yes. The important thing was my reaction. At the front of my brain, I said, "Fantastic! That's broken the ice." The back of my brain, it said, "How dare she interrupt me?" Because I'm Anglican priests are part of a hierarchy. And hierarchies are not used to dialogue. Hierarchies are a different kind of leadership. So I agree with you totally. Every dialogue is a huge challenge to your own assumptions and to your own assumptions of who you think you are.
Thank you very much to both of you for the valuable answers to both questions, which I think do narrow down to the significance of dialogue and its important role in seeking methods for change and allowing all voices be heard on an equal and safe space from all levels of society. Thank you everyone very much. Thank you both again to both the three of our speakers who Jennette has had to leave early, and all our viewers online who have engaged with their questions too. We will be discussing the same topic next Wednesday, but participants from across the globe, including Asia, the US, and a few European countries too, sharing their experience as communities and hopefully trying to find a common ground, perhaps learning from their best practices too. please do, keep up with that and keep following. Do also follow us via social media, our YouTube channel, Twitter, Instagram, Facebook, and the rest of it, to keep up with the work, and also share, your views, your concerns, allow it to be a platform for dialogue too. So again, thank you very much. Thank you to all our speakers and you. Thank you very much.
Pleasure. Assalamu alaikum.
Thank you. Bye-bye.